Welcome everyone. I'm Elizabeth Miller, a functional medicine certified health coach at Vallejo Health and Wellness Center in Eden Prairie, and I am here today with Dr. Aaron Moreland, who is the owner of Vallejo Health and Wellness Center and a practitioner here as well. He recently finished the Bredesen protocol training through the Institute for Functional Medicine, and so we're here today to talk a little bit more about Alzheimer's disease. So, just to start out,
yeah, well, I'm excited to be able to talk about Alzheimer's disease. It's not a disease that people are typically excited to talk about, but
right.
I think that the reason why we have the excitement is that we get to present to people that there is things that can be done for Alzheimer's disease, which I would say that most of us don't even know that that's a possibility. So excited to be here today. Yeah.
Awesome. Well, could we start out just with you telling us a little bit more about what Alzheimer's disease is?
Yeah, absolutely. And I think when we hear that word Alzheimer's, I think most of us right away think of, hey, a memory issue, that getting older, losing my memory, and some of us are thinking, okay, is this just part of normal aging, or do I have a disease? Walk into a room, not sure why we went into that room. And so some of that can be normal aging, but some of it can also be signs of the process of Alzheimer's disease. And really understanding what Alzheimer's disease is, it is a degenerative process that happens in the brain. It does start in that temporal lobe. The temporal lobe is where our memories are created.
Okay.
And so it happens to affect there first, and so that's what people will see. But it starts to progressively move through the brain, and it will move towards the frontal lobe, which is the part of the brain that affects our behavior, our executive functionings, our decision making, and also our personality. So that person that's got Alzheimer's, they'll notice that they're losing their memory, but then they'll also notice personality changes. They'll notice not making the greatest decisions. They'll get lost when driving, that kind of thing. And then it will start to move backwards in the brain and move to a part of the brain called the midbrain, where our vital functions are controlled, and that can affect our breathing. And unfortunately, a person can literally die from the disease.
Yeah, it's a really devastating disease to watch. I mean, my grandpa had it, so I saw a lot of that progression that you were talking about. But, you know, that being said, my grandpa having had it, a lot of people say it's genetic.
Yeah.
So can you touch on that?
Yeah, definitely. I think before that, though, just to talk about some of the people that maybe we've seen, if you grew up in the 80s and the 90s, I think we all remember seeing Ronald Reagan go through this disease. And I don't think a lot of us really knew what the disease was until we saw him go through it. And here was a vibrant man. He was an actor at one point, a governor, became the president of the United States. He seemed like he was pretty fit and a healthy guy. And yet we started to see in the later years of his presidency a lot of things that we kind of joke around. He's fallen asleep during his meetings and such, and kind of joked that his wife was Nancy Reagan was running the country the last year and a half. And unfortunately, some of that was true because of how that disease was progressively impacting his brain. And unfortunately, he did die of the disease. And so I think as we watch that, we wonder, well, how did he get that disease?
Right.
And I think that a lot of people, we will see it run in families. You will see, hey, we've got a family member, maybe we've got multiple family members that are dealing with Alzheimer's. And so genetics do play a role in it, but there isn't like one gene that you'd say that, hey, you've got the gene, you're going to get Alzheimer's disease. If you have the gene like APOE4, you are more likely to get it.
Okay.
But if a person worked and did all the right things, it does show that they really reduce their risk. So just because a person has the gene doesn't mean that they're going to get the disease. So it does beg the question as far as, well, what does cause the disease?
Yeah.
But it's not strictly a genetic disease. So.
Okay, interesting. And so once someone already has Alzheimer's, like, is there anything that they can do? Is there any hope there?
Yeah, good question. And I think the cool thing is that Dr. Bredesen is seeing, he developed a program called the RECODE program, and he's a neurologist, and he's worked on a lot of research on trying to help people with Alzheimer's disease. And so he's worked in his own clinic. He's worked on over about 1,000 patients, and over the course of working with those 1,000 patients, tracking and seeing how they're doing, improving and such. And of those 1,000 and some patients, he's seen 100% of them show improvement. Okay,
Wow.
now some of them it may be like significant improvement where they went from they couldn't even get out of a chair and now they're back working in their job, to a person that maybe they couldn't dress themselves and now they're buttoning their own shirts, which doesn't sound like a lot, but if you're a caregiver for that person
Right.
and now that person can dress themselves again, that's huge.
Yeah.
And so to answer your question, I think most of us when we first heard of Alzheimer's and saw it happening in people and haven't really seen anybody really improve from it, most of us just see it as, hey, it's a progressive disease that I'm going to follow these steps and eventually end up dying from the disease, to now we're seeing that there is hope. And we're not about giving people false hope, but if we saw that there was no hope, if we saw that, hey, there's lots of things that have been tried and nothing's helping them, then we wouldn't tell them that there is. But seeing Dr. Bredesen's protocol, seeing it work and seeing people improve with it, definitely there is hope.
Awesome. And I know that there's some different medications out there for Alzheimer's, but could you tell us a little bit about like that medication versus the Bredesen protocol?
Yeah, absolutely. And I think that, again, you look at some of these other diseases like cancers, we're seeing some really good strides with cancer and helping someone that's been diagnosed with cancer be even cured of cancer. And that's the same with heart disease and such. So you look at some of these medications that science has produced and seen like major breakthroughs. But when you look at Alzheimer's, and they've been researching Alzheimer's for many years, and you look at the different medications that are out there, the most popular ones, you see some improvement in some patients, you see no improvement in some patients, and in some patients you actually see them get worse when they're on the medication. And unfortunately, to this point, we've never seen anyone cured of this disease. So again, we all know someone that's been cured of cancer or heart disease. There isn't anyone that's been cured through medication from Alzheimer's. And the protocol that we're doing isn't necessarily a cure for Alzheimer's. What it is helping that person to function better, you're working on the things that are causing their brain to start to degenerate.
Okay. So that being said, what would someone be able to expect if they start the Bredesen protocol?
Yeah, that is a great question, because you're always, what am I getting myself into when I go down that path? And this is what I would say is that there isn't one protocol for every person, okay? What we do is really take an individualized approach. Dr. Bredesen, when he first started doing the research, he looked at 36 different reasons, and he always would make the analogy to if I had 36 holes in my roof, so those 36 different reasons why somebody has Alzheimer's need to be addressed. Maybe not all 36, but a lot of them. And so now they actually see that there's actually even over 100 different reasons why. So there's a lot of different reasons why someone could have it.
Right.
And then you look at approaching their health, there's a lot of different ways to help that person, because we're all unique and different. And so we can take an approach, because there's different types of Alzheimer's. There's really about 6 different types.
Okay.
And so inflammation being one, which can be diet related, can be infections. Another would be blood sugar issues in the brain, so addressing that. Another could be not enough hormones that are going on in the person that help the brain. A person could have traumas, they could have blood supply issues, so vascular health, they may have strokes, that kind of thing. All those different things can cause it, and so we need to address them all. So when we first see a patient, what we'll do is determine, okay, well, what's going on, why they even have it, what are some of those causes. A lot of times you'll see that it's more than just one type. You'll see even a few different types, from a person dealing with toxins to a person dealing with infections. And so what a person can expect when we work with them is to first and foremost determine what's causing it and then address that.
Okay. Yeah, it sounds like there's a lot of opportunity for personalization there.
Absolutely.
So,
yeah.
Yeah. And, I know some people might not be ready to jump right into a protocol or tell their loved one or who they're taking care of about the protocol. So we're doing a series of videos to help inform people about this. And how would they make sure that they get access to those videos?
Yeah, you make a great point, because we look at Alzheimer's, especially people that are trying to prevent it or maybe they got early signs. There's a lot of things that they could do without even having to go see a doctor. They can do a lot of things on their own. So what we've done is put together video series that people can sign up for, get the videos, and it'll teach them a lot of things from, you mentioned, how much the genes play, how much of a role does genes play, or what kind of things are causing this, what can they expect as they go through either a protocol or just things on their own. So the video series is going to cover those things. We're going to talk about, well, what is the disease, really getting into more of the nitty-gritty of what Alzheimer's is, how can you determine if you have it or not, or if you're showing early signs, is it Alzheimer's or is it just normal aging, talk about the different types, what to watch for, looking at how do I address fixing those problems. So that's what the video series is going to be about, and really very easy for people to sign up for it, whether they're watching this on YouTube or Facebook. They can there'll be a link where people can click on it, give us their email address, sign up for it. They'll get the videos, and they can go through those videos and learn how they can take care of their body, how they can take steps to either, like you said, prevent it, slow it down, or even reverse it.
Okay, awesome. And who should really be watching these videos? Would it be people who have a loved one with Alzheimer's, someone who's concerned about getting it themselves?
Yeah, I would say that probably everybody that's around could benefit from watching these videos, because a lot of the stuff we're going to be teaching can also be helpful for other conditions as well.
Right.
But the ones when we're really looking at Alzheimer's, someone that's looking to prevent it, I would say my wife works in a memory care facility, and I do see the residents, the family members, the caregivers. They're worried about it because they look at, especially if you have a family member, like, is this my future? Am I going down the same path? Am I going to be, is this me in 15, 20 years from now? And I think that's pretty scary for most of them. And so I would say for sure these people that are dealing with a family member, because like I said, it can be prevented, it can be slowed down. So those people that want to do that, I'd say the people that are showing some early signs, and again, if they're not sure, do I have Alzheimer's or is this just normal aging, these videos would be perfect for them. It can help to answer that question for them. And then as far as the people that already have Alzheimer's, especially if it's progressed quite a ways, I would say these videos, they're probably not going to get much out of these videos, but I would say their family member, their caregiver could, and they could start implementing those different things that we're going to teach them. They can start incorporating them into that family member's life and see if that can help improve their loved one.
Okay. And say someone's watching this and they know right now that, they don't even want to spend time watching the videos, they just want to start the Bredesen protocol. What would they do? Yeah,
so in order for someone to just jump right into our office, maybe they're looking at, okay, this seems a little overwhelming, I don't even know where to start even with the videos. I would say that the best thing to do is for them to just call and schedule an initial appointment. And that initial appointment, what we'll do is figure out, well, what type of Alzheimer's are you potentially going down, or if you are dealing with what type of Alzheimer's is it, and then looking at, well, what kind of testing a person needs to get done, and then addressing, okay, looking at, these are the things that you should be doing, you personally, to help yourself to, again, prevent it, slow it down, or reverse it.
Awesome. Well, it sounds like we've got lots of good videos to look forward to.
Yeah, and I'm excited.
Me too. I appreciate you being here and talking to everyone, explaining a little bit more about Alzheimer's.
Yeah.
And then if you'd like those emails or if you would like to see the videos, click on the link and provide your email, and we will send them to you.